Zero conversion is when someone becomes positive, you're negative, and then you become positive. I'm negative, I'm taking my PrEP. And you know, at every refill of PrEP, you have to run a HIV test for them. PrEP is only for negative people. Because the whole point is for you to remain what? Negative, right? But then, there are some people who you give this PrEP. It's one thing for you to collect PrEP. It's another thing for you to use the PrEP. It's another thing for you now to be consistent with it. So if you take that PrEP, you use it when you think you like it. Sorry, you might zero convert. And it's a very bad thing. It's a bad thing when you zero convert. It's not nice because you had all the things with you. You were on PrEP. It just shows that you lacked what? Adherence. And the chances that you might not adhere on your ARV. So that's what zero conversion is about. Now, asymptomatics are people who immune system might not really not show a sign. So they might be down with the virus. They might contract HIV but have no symptoms. The only way they will find out is when they go to the clinic to go and run a test. The result comes out, they're HIV positive. Now, there are some people that are symptomatic. After 6 weeks of infection, it will start. And you know the ones it starts with? The headache, the abdominal pain, the feverish, feeling feverish, night sweats, and the likes. They have what? The symptoms, because the immune system has been suppressed. And finally, AIDS. When it gets to that AIDS stage, you have opportunistic infection. These are strong infections. Called strong infections, really strong ones, that when a doctor sees you, this is AIDS. Do we get it? Next, please. Immune system suppression. The HIV attacks the white blood cells called the CD4 cells that protect the body from illness. Over time, the body's ability to fight common infection is lost. Opportunistic infections occur, like I mentioned before. When the HIV virus goes into the body, it goes for the white blood cells. It goes and it attacks the white blood cells so that your body is open to any of the infections that it can accumulate. And that's why we want to run a test for a HIV infected person. I mean, to check the level of adherence, we always do the CD4 count. Is that clear?
Yeah.
Do we get it? Next. Direct infection of organ system. The HIV will affect the brain, the gut, and the heart. Sometimes they have lots of memories. So these are opportunistic infections. Where is our notes? Can you identify some? Can you explain some to us? Let me pick one. Let's go for this one. Cryptococcal meningitis. What is that? Thank God you're a medical student here. Well, as you can see, it affects the brain. I think it affects the brain. So these are opportunistic infection. When it gets to AIDS, these are the symptoms, the diseases that will affect the person. The one I know of is tuberculosis itself.
Yeah.
And then HPV, genital herpes, a whole lot. And they will be coming left, right, center, left, right, center. It's crazy. Next. Am I blocking you?
No.
Progression of HIV infection, high viral load, number of copies of HIV in the blood, low CD4 count, type of white blood cells, and increasing clinical symptoms such as opportunistic infection, like I mentioned before. How you know someone is down with HIV? The viral load increases. It increases. But when I deal with that medication, it does what? It reduces. That's when you go and check your viral load. It's showing less than 20 and all. But someone who is not taking medication, it will be like 1,000 copies, 1,500 copies, 700 copies. It's high. And guess what? The medications, the ARV we have now are good medications, which taking it adequately in less than a month or after a month, you should have your viral load suppressed. Before, it used to be 3 months. Before, it used to be 6 months. But now, 1 month. And you know what suppression is? You can't infect anybody. You can have a child. The child won't get infected with HIV. You can have a partner who is negative. Your partner will contract HIV. Are we clear? Next. So in summary, HIV multiplies inside the CD4 cells, destroying them. As CD4 cells count decreases and viral load increases, the immune system, guess what, weak. People infected with HIV are vulnerable to opportunistic infection. HIV is a chronic viral infection with no known cure. There is no cure for HIV. There is what? No cure for HIV. Without ARV treatment, HIV progresses to symptomatic disease and AIDS. So the most important thing is what? The ARV treatment. HIV is transmitted how? We mentioned a few of them, but let's see them. HIV is transmitted by direct contact with infected blood, sexual contact, oral, anal, or vagina, direct contact with semen or vagina or cervical or secretions, mother infected with HIV, infants during pregnancy, delivering, and breastfeeding. Is that clear? Do you have any question in that part? Is that clear?
Yeah.
Next. HIV cannot be transmitted how?
Saliva, hugging, food, sharing,
Ordering.
yes.
Okay, go. HIV cannot be transmitted by coughing, sneezing, insect bites. Mosquito bites and bites are HIV positive. You're not going to contract it. Touching, hugging, water, food, kissing. That's when you pull out, starts back. If vitamin is negative, what do you do?
That's it.
So, if vitamin is negative, so that means the patient is negative. Do we get it? Is that clear? If vitamin is positive and Unigod is negative and start back is negative, what happens? If vitamin is positive, Unigod is negative, start back is negative, what do we do?
It's negative.
It's negative.
Since sweet.
Now you the deeper. You're the one thinking it. Do we all get what we're talking about?
Yes.
Do we all get it? Is anybody confused? Do you all get what we're talking about?
Yes.
Let me just try to talk about that. Like what he's trying to say is the determinant, the Unigod. That these are the determinants. The first one we use the determine tell you whether the person is reactive. So if the person is if it shows reactive from the first test, which is the determine, then you test with Unigod. So the Unigod will tell you whether the person is positive to HIV or negative. Then why you're using Unigod is because for you to correspond to check what the first one, which is determine what it has read, because you can have a reactive test to the first one, which is determine, and it might signify that the person is HIV negative. So after you use Unigod is just to confirm it that okay, this person is not just reactive but a positive to HIV, because one can actually be reactive to the first one and not HIV positive. So that is just
Do we get it now? Is it clear? Is it? Okay, so prevention of HIV transmission. Public health strategies to prevent HIV transmission. The first one was what? Screen all blood. We said that. And blood products. Follow universal precautions. I'm very sure every one of us that have laboratories and the likes now organization and whatnot on the walls, because I think that's one of the things practice we don't really do in this country. Because everybody's trying to meet targets, everybody's trying to make money, everybody's trying to, it's not good. We end up losing life, we end up losing numbers of people. We should learn the habit of referrals. Any question before we move to the next? So we just did the basic facts about HIV. Any question, please? Any question? Anybody? If there's questions. If there's no questions, can I ask questions? Can someone please tell me the modes of transmission? No cross answer. And please tell us. Anybody? Okay. Mode of transmission, give me one. State, I don't want to hear quick. State in very constructed, like a nice way. I cannot hear you. Unprotected sexual intercourse.
HIV positive.
With a HIV infected partner. Next one.
Unsterilized sharp objects.
Unsterilized infected sharp objects. Next one.
From an infected mother.
An unborn child. From an infected mother to an unborn child. Who else? Yes.
No, I want to ask a question.
Okay, ask. We have Bruno.
I want to ask a question.
Yes, please.
Determine it.
Determine it. Okay.
So when it's reactive, you understand? Like for instance, there's a pregnant woman that came to my facility several years ago.
Mm-hmm.
That was working there. So the determine was reactive. The primary center. We don't do the Unigold and the star pack. We normally refer them to general hospital to do the other one. So it was negative. Understand? After like maybe 3 years ago, 3 years after, she was pregnant again. Another lab technician was there. She was also reactive to that HIV. We refer her to general hospital again. So in short cases, what can we tell the patient?
But you referred her the first time. She was HIV positive.
The determine was reactive, but the Unigo and star pack was negative.
But you just said you guys didn't have Unigo.
Yeah, we don't have Unigo and
So how did you know the Unigo was non-reactive? Was it what she
we
told
went to
you?
general hospital. And
Okay,
we got the
you
result.
went and they brought back the result.
Yeah, yes.
And the Unigo was non-reactive.
Yes, it was
Did they
negative.
use the stat pack?
They use it at general hospital to confirm if it is really positive or not.
So you guys used Tammy.
Yeah.
You're not supposed to use Unigo and stat pack, and it was negative.
Yeah.
It was negative. Right. Yeah. And then again she came back.
Yeah.
You guys used it, Tammy.
It was reactive also.
It was reactive also.
And they sent her back again. It was still negative.
Why didn't you guys refer her to another place for a confirmatory test? Aside the general hospital.
She just said facility at general hospital.
Did you guys go with her to the general hospital? Because I don't think she went to the general hospital.
Because the reason why I'm asking is that, for instance, if you have told the patient, maybe tell him or her that the determine is reactive and there's some other tests you
You need
must
to,
you
yeah.
understand. So you know some patients they will feel somehow that what is this? Why is it this one is reactive and something?
It is what it is. I mean, it is what it is. You have to tell them. So, as a healthcare worker, you can't work with emotions. The clients need to know what's happening. So, yes, the first one happened. You guys sent her to General Hospital. That happened. She came back. The second one again, in the space of 3 years, 3 different years. So, the first one, I could think of different reasons like, okay, can you guys check your test kits? Is it expired? Stuff like that.
Yes.
You can also
Or
now
specimen.
ask, oh, can you guys also follow up with the general hospital? Is she actually going to the general hospital, or is words of mouth that, yes, I've gone there, they said I'm negative? You understand? But this is space of 3 years.
Yeah.
Meaning, that test kit is not finished. Now don't get a new one.
Yeah.
You guys came back again, you drew another blood. Perhaps the lab scientists who had probably left with another one, so you can't do that one. So refer to another place for confirmation.
Yes.
And it's fine, it's a confirmatory test. You understand? Always refer another place for confirmatory. But there's an issue somewhere. Because your test kit is saying she's positive.
Can any other virus and infection in the system make the determine to react?
Well, I am.
Probably hepatitis or.
So I do know that certain test kits that react to both HIV and syphilis. HIV and syphilis. I do know about that. But when you're acquiring those test kits, you know, test kit is looking for the HIV virus. only HIV, except to get a test kit that says
HIV and syphilis.
Do you understand? So I don't want to think, plus I'm not a medical doctor, so I don't want to have that test. Okay. So can we move?
Yes.
So please again, for the last time, I'm pleading today, we can't be coming late. It doesn't work that way. We can't be coming late. Some people walked in when we were done with most of the things from the first slide, and it's not nice. It's really not nice. A whole lot was put in place for this training. Okay, so please tomorrow let's try to. We start today by like 10:30. The exact time is 9. What to start by 9? Fall under the community of the transactional sex, people who transact sex. Another key populations are the female sex workers. You know?
Yes.
Are you with us? Are you with us? So go back. The reason why I wanted to touch that briefly was it says had sex with someone who has a history or any of these. I said key populations are the people who are mostly affected by what? HIV. Someone comes to your clinic and you're having a counseling session with that person and you're asking the person, how many sex partners have you had in the last 3 to 6 months, right? It's a man that is in front of you. The person tells you, I've had 5 sex partners. Okay, 5 females. No, my sex partners are 3 females, 2 males. And the next time I come out to me, hey, you feel like I can get out of this place. You know the funny thing, I was just dramatic now, self. You don't even have to do that. You're writing now, Nostity, you're being very serious, looking pretty. How many sex partners do you have? 5. Okay, 5 male. No, 3 male, 2 female. Okay. Guess what? Chances are the person will get up and leave. And guess what? If the person is as crazy, that crazy client, so you know, they will drag you and your hospital to it and they will revoke your license. Yes. That's the good part though. In your head, you're doing good, Abby. In your head, you are protecting your. That's the thing. But do you know what we're trying to stop such behaviors? Because this person you've deprived services from, it's already bad enough that one of the issues affecting the healthcare sector is the law that they have to criminalize homosexuality or something like that, right? It's already that law. So you see this person, this man that is telling you that his partners are male, and you're depriving him of treatment. You deprive him of treatment, no area before him, Abi. Family will start pressuring him to go and get married. And because he wants to cover his shame, he will go to the village to go and marry a wife, Abi. He will go for 10 minutes. Yeah? Can we do that? I don't want to keep you guys here hungry. So let's go for our tea break.
Wait, are we calling
Test. Sorry, they go and run their test. That's when you disclose, and you now tell them that, okay, this is your test result. Now, according to your pre-test counseling, you have high risk of contracting HIV. And I think you should be placed on PrEP. Oh, what is PrEP? PrEP is pre-exposure prophylaxis. Simple English. PrEP is anti-HIV medication. That drugs you take that prevents you from contracting. It does not cure HIV. It prevents you from contracting HIV. Shikina. As long as you're taking this medication every day correctly, you will not contract HIV. But you still need condom. Why? Why? Because of STI. So it's a package. Condom, PrEP, lubricant. Have you heard of lubricants before? Have you heard of lubricants before?
Yes.
Do you know why we use lubricants? People are talking like you don't know what is happening. You're looking at me like you don't know what it is. Do you know what lubricant is?
Yes.
It's to what? Create a plan with you. It's to what? Create a plan with your client. Now you've given this client PrEP or ARV. The next question that should come out of your mouth is, what challenges do you think you're going to face taking this medication? That's when the clients now tell you, my wife, I don't know where to keep this PrEP. My wife, if she sees this now, what would I say? You don't know where to keep her. You don't know where to keep PrEP. You don't know where to keep her police. Which one? Yes, now. Yeah. So you now have to create a plan. Okay, what's your morning routine? When I wake up, I do my morning prayer, I wake the kids up, I take them to school. Do you and your wife drive the same car? No. Do you mind putting this prep in the car? Do you want to leave this prep here? Since you live on the money, you have to drive by to come and take a bill. I had the clients who had this prep in my office.